Dr. J welcoming you to this video. In a previous video, I had mentioned that the two main pillars of good prenatal parenting is number one, communicating with the baby inside the womb, and number two, providing a safe environment for the growing baby within the womb. And a safe environment dependent on three factors. Number one, on your nutrition. Number two, on exercise. And number two, on your relaxation during pregnancy. In this video, I'm going to briefly touch upon the nutritional aspect of the thing. I'm not going to go into detail because even your neighbor will come and tell you what to eat and what not to eat during pregnancy. So your healthcare provider will tell you, how to take care of your diet. From our point of view, from the developmental pediatrics point of view, there are a few important things that I need to mention. Number one, folic acid. Make sure you have enough reserve of folic acid before you get pregnant, because folic acid is a vitamin which is very essential, which is very helpful in the closure of the neural tube of the baby, and that eventually forms the brain and the spinal cord. And the closure of the neural tube happens as early as 6 weeks after conception, a time when most of you don't even know that you're pregnant. So make sure you're taking folic acid prior to the pregnancy. Number two, take enough omega-3, the EPA, DHA, omega-3 fatty acids, very, very essential and very good, and they help in the development of the brain of the baby. Make sure you're taking enough calcium, because calcium is important for the bones of the growing baby. Make sure you're taking enough magnesium. Now, magnesium is important on two fronts. Number one, in the development of the growing baby inside the womb, and number two, magnesium also prevents the development of hypertension or high blood pressure during pregnancy. And we all know that if somebody gets a high blood pressure during pregnancy, you can have what we call preeclampsia and eclampsia, and that can be harmful to both the mother and to the baby. Make sure you take enough zinc during pregnancy, because zinc helps in making the immune system of the baby growing inside the womb strong. So that is about some of the important points of nutrition and supplement that you should keep in mind when you're pregnant. So we've just seen what to take during pregnancy. Now let us look at what not to eat, what not to consume during pregnancy. Because we know that the origin of adult disease, the diseases that we suffer when we grow up, hypertension, heart disease, diabetes, cancer, and a host of other diseases have their roots in fetal life. And one thing you have to remember is that when the fetus is growing inside the womb, the organs go through certain stages of development which are called the critical periods of organ development. Those are periods when an organ is developing at a particular rate, in a particular manner, and your nutrition at that time for that particular organ is extremely important. Because if for some reason or the other, if the nutrition of the mother is not proper, then that will lead to some kind of problem with the development of that particular organ, and in later life the person will manifest diseases pertaining to those systems. So that's why watch out what you eat. Now, pregnancy or no pregnancy, the rule of thumb is that always avoid packaged, canned, processed foods and fast foods, because all these foods are not good foods. They are loaded with additives, preservatives, coloring agents, and all kinds of chemicals that are not good for health. Now, for a long time, we have been totally misled by the food industry, and they have made us believe that what we eat out of these cans and these jars and these packages are good quality foods. They are not. There are certain chemicals that you need to really watch out for. One that is very dangerous for health is BHA and BHT. So if the label on the food says BHA, BHT, avoid it. It's a preservative that is linked to cancer. Monosodium glutamate, MSG, again, it's a flavoring agent that is usually found in soups and canned foods and confectioneries and cookies and candies. Again, it's linked to sudden cardiac death and is not allowed to be eaten. Aspartame, the artificial sweetener, fashionable. You know, when you go to a coffee shop, you'll see people pull it out of their pockets and put the tablets in their coffee or tea and drink it. Very bad for your health. It's linked to brain tumor. It's linked to leukemias. It's linked to lymphomas. Saccharin, another artificial sweetener related to cancer. So all these sweeteners are bad. They've been linked to some kind of disease or the other. Acesulfame K, another artificial sweetener, can cause cancer, can cause thyroid disturbances. Olestra, a fat substitute, supposed to be healthy, gives rise to major gastrointestinal disorders. Sodium nitrate, it's a preservative, again linked to cancer. The big one, high fructose corn syrup, a real bad substance that gives a surge to the level of fat in the system, elevates the cholesterol, gives rise to obesity, gives rise to diabetes. So you got to be careful, you got to watch out, look at the food label. Please don't be misled by these food manufacturers. And lastly, be careful about your sodium intake, because in pregnancy, you know, most of you young girls have morning sickness and you need to take something saltish. So you get into crackers or nuts and so on, and they're loaded with salt. And salt, as we know, can give rise to hypertension during pregnancy, and hypertension during pregnancy can give rise to preeclampsia and eclampsia, which can be dangerous for the mother and the baby. Now, the reason why I'm telling you all this is because whatever you eat eventually gets filtered through the placenta and goes into the system of the developing baby. So it can hurt right from top to bottom, right from the brain to the heart to all the other organs in your baby. So watch out for all these dangerous substances. My best advice is to eat good food, fresh food, homemade food and healthy food. Good for you and for your baby. Absolutely avoid uncooked and raw meat, because raw meat can give rise to salmonella infections, can give rise to coliform infections, and can also give rise to toxoplasmosis, which can actually go and cause calcium deposits in your baby's brain and can be dangerous to the baby. So avoid uncooked and raw meat. In seafood, fish containing mercury, mainly saltfish, kingfish, sharks, mackerel. Any fish that contains mercury can cause brain damage to the fetus. So avoid sushi and look out for the fish that I have told you. Raw eggs can cause salmonella, so avoid raw eggs totally. Soft cheese and unpasteurized milk, that contains a bacteria called listeria, and listeria can cause miscarriages and premature births and life-threatening infections in the fetus. So just be careful about what you're eating and just try and avoid what I've just told you. Avoid smoking during pregnancy, because smoking can give rise to miscarriage and it can also give rise to small preterm babies. So please, if you're a smoker, quit well before you get pregnant. Alcohol is not allowed during pregnancy. Don't tell me that you're just having a glass of wine with your dinner and that's okay. No amount of alcohol is permissible. Alcohol can give rise to something called a fetal alcohol syndrome, in which you get mental retardation, brain damage, preterm babies, facial defects, heart defects, miscarriages, and a lot more. Street drugs, any kind of street drugs, marijuana, cocaine, crack, they are absolutely banned. They can cause miscarriage, they can cause brain damage, they can cause preterm births, and they can cause fetal deaths in the womb. So please avoid all these dangerous drugs. Now, we have said this about women, but men, please listen to this carefully. Smoking and drinking can lead to fertility problems. So if you're having problems conceiving, look into the fact that you don't smoke and you don't have excessive drinks, because if you do that, then that spoils the quality of the sperms that you produce and interferes with the fertility process. Lastly, one substance that is causing a lot of problems in our lives and has really penetrated our society, and that is plastic. Now, plastic is a petroleum byproduct. It's a chemical. And our food containers, our shrink wraps, our drinking glasses, our drinking bottles, our feeding bottles are made of plastic. Now, plastic contains a substance called bisphenol A, BPA, which has been linked to genital deformities in growing baby. It has been linked to Down syndrome. It's linked to mental retardation and also to cancer. So, from a health point of view, really you should always avoid using any kind of plastic containers, even if you're not pregnant, on a day-to-day basis. Because remember, I mean, in this world today, it's alarming the amount of cancer that has gone up. It's alarming the amount of other diseases that are just going up. Despite the fact that we think that we are eating healthier, we are not. So make sure you drink out of a glass bottle, So please protect yourself, and more importantly, protect the baby that's in your womb, because really it is your total responsibility. I mean, I know you have no control over the outside world. You have no control over plastic manufacturers. You have no control over fast food restaurants. You have no control over other food industry, but you have control over yourself. And you are responsible for the baby inside. So please take care of all these things that we have discussed in this video. And in the next videos, I will talk about relaxation of the mother and also exercise. Till then, take care of yourselves. See you soon.